As you guessed it, we're going to be talking about the CORE Digital Stethoscope and taking a blood pressure with it. And off camera, I work as a medical professional and I am a person with sensory neural hearing loss. My overall goal is to help people be healthy and to stay healthy, advocate for inclusion for all people regardless of their hearing loss level, and to eradicate hearing loss stigma. Yep, that's my overall goal. And with that combo, I am a peer mentor for medical professionals with hearing loss. So welcome to Healthy Hearing Loss. My name is Dee Dee. So as we mentioned, we're going to be talking about the CORE Digital Stethoscope and using it to take a blood pressure. In the description, I put some timestamps so you can go straight to the CORE discussion if you want to, but I am going to be discussing the blood pressure itself, and it's always good to review blood pressure because you never know what changed. So I highly suggest and invite you to go ahead and watch the entire video. And if you stay at the end of the video, I will provide a technique that you can use for yourself at home to help reduce your blood pressure. There are many healthcare professionals, like we have licensed nursing assistant, certified medical assistant, we have licensed practical nurse, a registered nurse, we have a nurse practitioner, physician assistant, medical doctor, and of course there are those of you who are in the process of learning to become one of those. If you are in school, let me know in the comments what you're in and keep us posted. All of those professionals take a blood pressure at some point in their career. They learn it in school and then they take it when they're out in practice. However, there are some professionals that take it more often and others that do not. Wherever you are as far as taking blood pressures, I am going to review the blood pressure and I'm going to cover 5 kind of areas surrounding blood pressure. I'll be talking about the history, types, and different sizes of blood pressure cuffs, what could affect a blood pressure, and where and how to actually take a blood pressure. We'll begin with the history. I'm going to put a graph up here, but we are going to say the medical word for a blood pressure cuff. Sphygmomanometer. 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 Or anywho, the blood pressure cuff has been in use for over 100 years. And in this graph, I'm going to show you in 1733, there was an English clergyman. Now, I took this from an article, so I'm almost not exactly taking it word for word, but I'm sort of going to try to paraphrase this. Stephen Hales invented the manometer. And a manometer is a measure of pressure. And in 1896, we had an Italian physician, Scipione Rocchi, invented the process of using a cuff-based mercury sphygmomanometer by palpating a radial pulse. And then that was further enhanced. In 1905, a Russian physician, Nikolae Korotov, I'm not good with pronouncing names, as you can tell, did the artery auscultated with a stethoscope while the sphygmomanometer cuff is deflated. Basically, he defined the systolic and diastolic blood pressure measurements and clinical recording of blood pressures. At the beginning of the 19th century, 1910, according to this article, essential and malignant hypertension were defined. Interesting. And then he goes to mention a very interesting fact. In 1937, the public started to understand the need to treat hypertension due to the death of President Roosevelt. And he had some pretty significant elevated blood pressure, and he essentially died because of his high blood pressure that was not treated. So that kind of woke the public's eye and the medical field's eye that said, hey, we got to treat, right? Now, what types and sizes of blood pressure cuffs? And I'm going to just kind of go right through this one really quick. We know that there's a manual blood pressure. We can take it with a stethoscope and also without by palpating the radial pulse. So we have an automatic or digital blood pressure monitors, and those can be obtained on the wrist or the upper arm. There are different sizes. There's infant, pediatric, adult, standard, and then large and extra large and so forth. In this video, I will be covering the manual standard adult blood pressure on my patient. Now, generally, I do not record these videos in a clinic. I usually do it in my office studio, and I don't usually have an assistant. And I've complained about this in previous videos because it just makes it easier when you have an assistant or a simulated patient. So I got my creative hat on and I decided I'm going to get one. That's right. And I have my patient over here that I'm going to introduce to you shortly. But let's go on more about why do we take blood pressure? Well, there's a lot of reasons to take blood pressure, right? It's a tool to measure the pressure within our vessels. And if the pressure it is too high in those vessels, then it can cause too much pressure in our hearts, our kidneys, our brain. So it's really important to make sure that we take a look at blood pressures at all times. Over a long term, if you have elevated blood pressure, as we all know, it can cause cardiovascular disease as well as kidney failure. Two things to mention about the blood pressure is that the systolic is the pressure being pushed out of your heart. So that is your top number, the systolic number. And then the heart will relax and open up, and that lowers the blood pressure at the bottom number. So that is systolic is contracting, relaxing is diastolic. Now, blood pressure is kind of an invisible disease initially. It can go unnoticed because you just really don't have any symptoms initially, right? But if it is high over time and very elevated, there are some patients that will, like President Roosevelt, he started feeling lethargic and dizzy and went into coma and died. Yeah, that's what happened to him. He had congestive heart failure too, all that stuff. Not good to have blood pressure elevated over time. So that's what causes cardiovascular disease and damage to your kidneys. Now, normal blood pressure in an adult anyway is to be less than 140/90. Those are in the guidelines. Of course, we are going to 130/80, but that is a certain group of adults. We're talking about elderly. You want to be a little careful with that. All right, that is a whole different video. I don't want to talk about all the guidelines and diagnosis and all that stuff. No, let's go on to what can affect the blood pressure. Now, we start to worry about blood pressure. We'll take 2 consecutive blood pressures before we start to investigate why a person would have an elevated blood pressure. And there's a bunch of things that can cause elevated blood pressure. One thing is physical exertion, stress, pain, extreme cold, extreme heat. One is the white coat syndrome. Notice I'm not wearing a white coat. I don't like to wear a white coat when I'm with my patient because of this whole phenomenon of a white coat syndrome. People tend to get a little stressed when they go to the doctor's office and see the doctor wearing a white coat, and it just kind of elevates their blood pressure. Why I like to recommend blood pressures at home. So they would take their blood pressure, every day for a few days and whatnot, and bring the numbers that they write in their blood pressure log and bring it to me so I can look at the blood pressures and go from there. Because when they're at home, they're not stressed out by the white coat. They're home and relaxed. If not, stay tuned to the end of the video. I'm going to give you that technique. Obviously, we know that if we can identify blood pressure, elevated blood pressure that's too high, hypertension, the medical term for it, is that we can reduce the risk of consequences to the body, to your heart, to your kidneys, and to the rest of the organs, the internal organs. They don't like it. They don't want to be under pressure. Under pressure. Why do we always think of a song when we say a phrase like that? Under pressure. I'm out of position. Nope. Okay, so how and where do we take a blood pressure? Well, obviously there are many areas we could take a blood pressure. We take it in the primary care office. This is where I work. We take it into the hospital, ICU or emergency room. But the most important thing is to be able to get an accurate blood pressure the best you can, right? We're going to be talking about the manual blood pressure for this video anyway. So we want to instruct our patient to not eat, smoke, drink 30 minutes prior to getting a blood pressure taken. Now, we're talking about smoking because we know that it constricts the vessels, but drinking caffeine, or drinking coffee or alcohol for that matter can affect your blood pressure. If you have a full bladder, you want it, go to the bathroom and empty it out, because if you're dancing around because you gotta pee, it's gonna raise your blood pressure. And we want to instruct our patients to sit back into their chair with both feet on the floor, legs uncrossed, and relaxing for 5 minutes before we take a blood pressure. Especially in a clinical office, primary care office, this will reduce the white coat syndrome. And when we take the blood pressure, let's go over to my patient. This is Jade. It's a mannequin. It's the best I could do, okay? I have to have something that I can simulate my assessments or show how to take a blood pressure, right? So this is Jade. She's kind of cool. She's quiet. She's laid back. She just kind of sits there and listens to me. So with the blood pressure, we want to put it on the upper part of the arm. It should fill about 80% of the upper arm. And we want to put the blood pressure cuff on the upper arm, and we want to make it snug, but not like yanking tight, right? We don't want to hurt you, right, Jade? Right. I talked to a mannequin. It tells you how crazy I am. It has artery on this little blood pressure right here. It gives you an arrow, and that arrow tells you to point to the artery. Now, how are you going to know where the artery is? You palpate it. The brachial artery is in the inner portion of the arm. So you take 2 fingers, you rest it on top of the inner arm, and you feel for the brachial pulse. That's where you're going to put your stethoscope, right? So there we go. We have the placement of the blood pressure. Now, Jade doesn't like to bend her elbow, but you do want to have the elbow about the same level of the heart in the chest area. And the arm is going to be resting on something, maybe a table or something like that. I could put a pillow here and have her rest it. Can you hold your arm up for me? All right, so there you go. There you have it. And the other thing to mention is that we do want to make sure that it's bare skin. Let me take this off. Hold on. I had it over the clothing. That's a no-no. Slide it up and then place the blood pressure cuff on bare skin. And there we go. And then I usually just roll this thing down, tuck it in there so it's not flopping over my manometer. That's the pressure thingy. Or is that the tubing itself? Well, that thing, the dial thing that is connected to. Yeah, that. You want to keep that exposed so you can see the little needle going boing, boing, boing. Now, some of the challenges, obviously, is going to be a patient that does not want to move their clothes, right? They have a long sleeve, it's cold in the office, and they don't want to take their shirt off. So you do the best you can and just go over the clothes. It can be difficult to take a blood pressure if you're in a situation where there's an urgent situation, an emergency, somebody's in a car or something, and you go take a blood pressure. Sometimes you just got to do the best you can, slap it on the arm, and just at least know that you have somewhat of a blood pressure. So as I mentioned before, we're only doing manual on this, but you can take an automated blood pressure on the upper arm as well as the wrist, automated, the digital ones. The blood pressures can be taken on the upper arm and also the ankles when you're doing an ankle brachial index, rule out or rule in a peripheral vascular disease. I do those a lot. Those are really fun. No, they're not. Jade, you can put your arm down now. Don't tip over. There you go. Stay put. Next, I'm going to go ahead and cover 5 areas with the CORE Digital Stethoscope when you're taking your blood pressure. A couple things to consider. Here's my CORE Stethoscope, right here, without the tubing. Here's the tubing. You have to decide whether you're going to use the tubing or not. I'll put it on, and this is the CORE Stethoscope with the tubing, with the earpiece tubing. You can use it 2 ways. You can use it just like this for analog, which is a regular traditional stethoscope. You put it in your ears, you listen normally, and you hear it just by itself like this. If you want to enhance the sound, increase the volume, you can still use it like this, but you need to turn on the toggle right there, and the toggle is what makes it digital. So now you have some volumes on here, and you can increase the volume and reduce it. I'll turn it off. Analog or digital, you decide. I'm going to talk about the head of the stethoscope. The big one is the diaphragm. The little one is the bell. I am going to say that I'm going to use the diaphragm for my blood pressure. And the only reason why I want to use the diaphragm is because it's easier to hold and it covers a wider area on the arm. So I'm going to go ahead and use the diaphragm. But research says, or studies that I've looked at, there's really no difference in using the bell or the diaphragm when it comes to taking a blood pressure. But traditionally, I have always used the diaphragm. So you can do what you want. Like I said, this is either analog or digital. I'm connecting directly to my hearing aids and they have Bluetooth. So I do not need this tubing. I'm going to use it just like this. That's all I have. I connect it to my hearing aids and it goes to my phone through the Echo app. Okay, so I can put this in my pocket. I can put this in my other pocket. You can't see that, but anyway, I'm going to use it just like this. So I've talked about a few things. Analog, digital, that's number one. Valve diaphragm, that's number two. Now we're going to talk about the diaphragm when you're placing it on the body itself. You want to have it exposed right to the skin. And there is a difference of whether you put a little pressure or a lot of pressure. But a lot of pressure, it can kind of distort the sound. This is my experience anyway. But if I put it on lightly onto the arm, I feel like I can hear a little bit better. So play around with that. A little pressure or a little bit more pressure. That's number three. So we're going to go ahead and take the blood pressure on Jade. First thing I'm going to do is palpate the brachial artery. Boop, 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 boop. I'm going to place my diaphragm right over it. I already have my blood pressure cuff in the right place with that little arrow pressing down in the artery, right down at the artery that I palpated. So I know where to put my stethoscope. And I'm going to go ahead and pump it up. And I'm going to show you on my phone through the Echo app the sound that it makes. Okay, so here we go. The blood pressure. Ooh, I just went to 300. This is a simulation on Jade. All right, so go ahead and check out the recording that I am taking right now on my Echo app. Listen. We got 122 over 62, and that is fantastic. I'm telling you, there is not a delay. If there is a delay with the Echo from me hearing it, comparing it to the Echo app, it is very minimal. We went over the blood pressure and how to take it, why to take it, the history about it, all that kind of fun stuff. And then we talked about the CORE Digital Stethoscope and how to take it on Jade here. If you want to review it, go ahead and hit the timestamp down below and go back and review anything you like. Time to discharge Jade and let her go home. And I'm going to recommend that you go home, and when you are feeling stressed out, you can take your blood pressure. It is probably going to be a little elevated if you're stressed out. And one thing you can do is go ahead and do a meditation. We're going to be giving you a 5-minute meditation to help you release stress, reduce anxiety, and lower your blood pressure right at home. 5 minutes a day, it's all it takes, right? Get nice and comfy when you get home, and I'll do a guided meditation for 5 minutes. Once you find a comfortable seat, allow yourself to root down into your seat with your sit bones. Elongate your spine. Go ahead and relax your hands down onto your thighs. With your eyes closed or softly gazing, allow your eyelids to be very heavy. And start to bring your awareness to your breath. Feeling the rise and fall of your chest. No need to change or manipulate it at this time. We're just noticing. We're going to do a scan of the body first. Go ahead and check out your face. Loosen any areas that are tight that you're holding on to between your eyebrows, around your eyes, down to your cheeks, and release your jaw. Soften your throat and release any tension in your neck. Soften the shoulders and allow your arms, elbows, hands, and fingers to be completely relaxed. Let your chest be light and your belly be warm. Release any tension in the legs, feet and toes. Bring your awareness to the space between your shoulder blades. And release any tension there. And then soften your entire back. Feel a sense of heaviness as you settle into your seat. In the present moment, if you find that your mind is wandering to your to-do list or thoughts about what happened yesterday, what you need to do tomorrow, just know that the only moment that exists is the present moment now with the current breath. You can't get back a past breath, and you cannot take a future breath sooner than it comes. You can only breathe right at the moment. So continue to breathe nice and easy, scanning the body again. And then I want you to imagine some clouds going above your head from one side to the other, just kind of floating by. This is an opportunity to allow the thoughts in your mind to just go into a cloud and drift away. If you can mentally do this, you will be amazed by its effect. Throw as many thoughts that you want into the clouds. Maybe they're going by fast because you have so many. But the more you let go of those thoughts into those fast, rapid clouds, you'll start to notice that they start to slow down as the thoughts start to diminish. That fight you had with somebody, throw it in the cloud. The mean patient, throw it in the cloud. Something you said that you didn't like, throw it in the cloud. Worrying about a presentation you're going to give, throw it in the cloud. So allowing those thoughts to just go by. You find yourself even more at peace, relaxed. Your body is completely heavy. And just a couple more breaths as you get rid of any other thoughts into those clouds. And then bring your awareness back to your body. Just noticing. Nothing is wrong in meditation. But one of the hardest things to do is actually just sit and to do it. Can you feel your heartbeat? Can you feel that it's slow? If it's nice and slow, then your blood pressure is probably pretty good at this point. Start to deepen your breath, taking an inhale through the nose and exhale out through the nose or the mouth. Take another deep inhale, holding at the top, and exhale, letting go of everything. Start to wiggle the toes and wiggle your fingers. And then slowly open your eyes. Go check out your blood pressure. Take care. Bye.